of hospitalization rates in several jurisdictions appears to be manageable, with critical care still trending at low levels. We remain hopeful that the increase in transmission rates over the past several weeks will not result in as heavy an impact on hospitalization trends as seen during earlier waves. This optimism is grounded in the knowledge of our better immune protection due to overall high vaccine coverage. However, maintaining strong protection against serious illness means keeping COVID-19 vaccinations up to date. Vaccination is a cornerstone of public health and is responsible for saving more lives in the past 50 years in Canada than any other health intervention. Unfortunately, data show there are not only gaps in coverage for recommended COVID-19 vaccinations, but also delayed or missed vaccinations for other serious infectious diseases during the pandemic. So today, we want to remind Canadians once again of the importance of staying up to date with all routine vaccinations. And as tomorrow marks the beginning of National Immunization Awareness Week in Canada, we want to reinforce the importance of vaccinations in protecting our health throughout our lives. This is also an opportunity to thank Canada's healthcare workforce, immunizers, volunteers, community workers, and researchers for all the work they've done and continue to do so to build a healthier Canada through immunization. Likewise, we want to extend thanks to Canada's Immunization Partnership Fund, or IPF, recipients. Supporting community-based initiatives led by organizations like these has helped increase vaccine confidence and improve vaccination access and uptake from the ground up. Throughout the largest and perhaps most complex immunization campaign in Canada's history, rolling out COVID-19 primary series and booster dose programs to provide Canadians with a strong foundation of protection, IPF organizations have played vital and innovative roles. These organizations use local knowledge, tailored outreach, and community interventions to reach underserved and undervaccinated populations to reduce barriers to vaccination by addressing information gaps and improving access. For example, Digital Public Square is receiving IPF funding to support the development of its online platform and tools to dispel rumors and encourage viral sharing of credible health information. Trusted health resources, including an interactive coronavirus quiz, are used to counter COVID-19 misinformation while challenging users to achieve top knowledge rankings and share the COVID-19 know-how with others. Science North is another IPF-supported project that is working to provide a comprehensive program of virtual and in-person activities in English and French to support vaccine decision-making. This project will include a public health expert podcast series and webinars for students, parents, and caregivers, as well as in-person, hands-on exhibits and workshops for family audiences across Northern Ontario. With COVID-19 still circulating widely in Canada, vaccines plus remain our main public health mantra. Personal precautions like masking, improving ventilation, and staying home if we have symptoms or test positive are still important to reduce spread. At the same time, it is very important to maintain a strong core of protection against severe illness by getting up to date with COVID-19 vaccines, including booster doses. Although there is uncertainty in the months ahead, both for the trajectory of COVID-19 and for other respiratory viruses like influenza that have been less common due to strong public health measures, the importance of vaccination is clear. To be prepared with the best possible protection against serious illness due to one or more of these diseases now is a crucial time for catching up with all recommended vaccinations that help us keep us healthy from childhood through adolescence and adulthood. Thank you. Merci. Megwitch.
Bonjour à toutes et à tous.
Hello everyone.
Avant la longue fin de
Prior
semaine,
to the
la
long
COVID-19
weekend,
est restée répandue au
COVID-19
Canada
remained
et il y
widespread
avait
across
des signes
Canada, with
avant-coureurs
early
que nous
signs
pourrions
that
avoir
transmission
atteint le
may
pic de
have been
transmission
nearing
dans
a
plusieurs
peak in
provinces
some
et territoires.
jurisdictions.
Cela dit,
However,
l'activité de la
with
maladie
disease
reste
activity
élevée
still
et la
high,
sous-lignée
and the
BA2
BA2
représente plus de
sublineage now
70%
accounting for
des
over
variants
70%
séquencés.
of sequenced
Il est donc trop
variants,
tôt pour
it is
savoir
still
si
too
les
soon to
activités de
tell
la longue fin
whether
de semaine
our long
vont
weekend
entraîner une
activities
autre
could
hausse de
lead to
nombre de
another
cas.
bump ahead.
Bien que préoccupante,
Although
la
concerning,
récente hausse
the
des taux
recent rise of
d'hospitalisation dans
hospitalization
plusieurs
rates in
provinces
several
ou territoires
jurisdictions
semble
appear
gérable.
to be
Le nombre
manageable,
de cas aux soins
with
intensifs
critical care still
demeurant
trending
peu
at low
élevés.
levels.
Nous continuons à
We remain
espérer que la
hopeful
hausse de
that the
taux de
increase in
transmission des
transmission
dernières
rate over
semaines
the past
n'aura pas une
several
incidence
weeks
aussi
will not
forte sur
result
les taux
in as heavy an
d'hospitalisation que
impact
celle
on
qui a été
hospitalization
observée
trends
au cours
as
des
seen
vagues
during
précédentes.
earlier waves.
Cet optimisme
This
est fondé
optimism is
sur
grounded in
la
the
connaissance
knowledge
de
of our
notre
better
meilleure
immune
protection
protection
immunitaire en
due
raison
to
de notre
overall
haut taux de
high vaccine
vaccination.
coverage.
Cependant, pour
However,
maintenir une
maintaining
protection
strong
forte contre
protection
les cas
against
graves, il
serious
faut que les
illness
vaccins
means keeping
contre la COVID-19
COVID-19
soient à
vaccinations
jour.
up to date.
La vaccination est un pilier
Vaccination
de la
is a
santé publique
cornerstone
qui a
of
sauvé
public
plus de
health
vies dans les
and is
50 dernières
responsible for
années au
saving more
Canada que
lives in the
toute autre
past 50 years
intervention
in
en
Canada
santé.
than any other health
Malheureusement,
intervention.
les données montrent qu'il y a
Unfortunately,
non seulement
data show
des lacunes dans la
that
couverture
there are not only
vaccinale
gaps
pour
in
les
coverage
vaccins
for
recommandés
recommended
contre la
COVID-19
COVID-19,
vaccinations,
mais
but
également des
also
vaccins
delayed or missed
retardés ou manqués
vaccinations
pour
for
d'autres
other
maladies
serious
infectieuses
infectious
graves au
diseases
cours de la
during the
pandémie.
pandemic.
C'est pourquoi nous souhaitons aujourd'hui
So today,
rappeler
we
encore
want to
une
remind
fois aux
Canadians once
Canadiens
again
qu'il est
of the
important de se
importance of
tenir
staying
à
up
jour
to date
dans ces
with all
calendriers de
routine
vaccination.
vaccinations.
Et puisque nous
And
entamons
as
demain
tomorrow
la
marks the
Semaine
beginning
nationale de
of
promotion
National
de la vaccination
Immunization
au Canada,
Awareness Week
nous
in
voulons
Canada,
insister
we want
sur
to
l'importance
reinforce
de
the
la
importance
vaccination
of
pour
vaccinations
protéger notre
in
santé
protecting our
tout au
health
long de notre
throughout our
vie.
lives.
Il s'agit
This is
également d'une
also an
occasion de
opportunity to
remercier
thank
les
Canada's
effectifs des
healthcare
soins de
workforce,
santé, les
immunizers,
vaccinateurs, les bénévoles,
volunteers,
les
community
travailleurs
workers,
communautaires
and
et les chercheurs
researchers
pour tout
for
le
all of the
travail
work
qu'ils
they've done
et
and
elles ont
continue
fait
to
et
do
qu'ils et
to
elles
build
continuent
a
de faire
healthier
pour
Canada
améliorer
through
la santé de la
immunization.
population du pays grâce à l'immunisation. Nous tenons
Likewise,
également à
we want to
remercier les
extend thanks to
bénéficiaires du
Canada's
Fonds de partenariat
Immunization
d'immunisation
Partnership
du
Fund,
Canada, ou
or
FPI.
IPF
Appuyer les
recipients.
initiatives des collectivités
Supporting
a permis aux
community-based
organismes
initiatives led
comme
by
ceux-ci d'aider
organizations
à
like
accroître
these
la
has helped
confiance à
increase
l'égard des
vaccine
vaccins,
confidence
ainsi que
and
l'accès à la
improve vaccination
vaccination et le
access
taux de
and uptake
vaccination à
from the
partir
ground
de la
up.
base. Tout au long de la
Throughout the
campagne
largest and
d'immunisation,
perhaps
la
most
plus
complex
importante et peut-être
immunization
la plus
campaign
complexe de
in
l'histoire du
Canada's
Canada,
history,
le déploiement
rolling
des
out
programmes de la série
COVID-19
primaire et
primary
des doses de
series and
rappel
booster
contre
dose
la
programs
COVID-19
to provide
afin d'offrir aux
Canadians with a
Canadiens une
strong
base
foundation
solide de
of protection.
protection. Les organismes du
IPF
FPI ont joué
organizations
des rôles
have played
vitaux
vital
et
and
novateurs.
innovative roles.
Ces organismes
These
utilisent leurs connaissances
organizations
locales,
use local
des actions
knowledge,
de
tailored
sensibilisation
outreach,
adaptées
and
et des
community
interventions de la
interventions to
collectivité
reach
pour
underserved
rejoindre les
and
populations
undervaccinated
mal desservies
populations
et non
to reduce
vaccinées
barriers
afin
to
de réduire les
vaccination
obstacles à la
by addressing
vaccination,
information
combler les
gaps and
lacunes en
improving
matière
access.
d'information et améliorer l'accès. Par
For
exemple,
example,
Digital Public
Digital
Square
Public
reçoit du
Square
financement du
is receiving
FPI pour aider à
IPF
la
funding
création
to
de sa
support the
plateforme en ligne
development of
ainsi
its
que
online
d'outils pour
platform
démentir les
and
rumeurs
tools to
et
dispel rumors
encourager le
and
partage
encourage
viral des
viral sharing
renseignements
of
crédibles
credible
sur la
health
santé.
information.
Des sources
Trusted
d'informations
health
fiables sur la
resources,
santé, dont un
including an
questionnaire interactif
interactive
sur le
coronavirus
coronavirus,
quiz, are
servent à
used to
contrer
counter
la mésinformation
COVID-19
sur le COVID-19,
misinformation,
mettre les
while challenging users
utilisateurs au
to
défi
achieve
d'obtenir
top
les
knowledge
meilleurs classements
rankings
en matière de
and share their
connaissances et
COVID-19
partager leur
know-how
savoir-faire
with
en
others.
matière de COVID-19 avec autrui. Science
Science
Nord
North
est un
is
autre
another
projet appuyé par le
IPF-supported project
FPI
that is
qui
working
œuvre
to
pour offrir
provide
un
a
programme
comprehensive
complet
program
d'activités
of
virtuelles
virtual
et en
and
personne,
in-person
en anglais
activities in
et en
English and
français
French
pour
to
soutenir la prise
support
de décision
vaccine
concernant les
decision-making.
vaccins. Ce projet
This
inclut une
project
série
will
de
include a public
balado-diffusion
health
d'experts
expert
en
podcast
santé
series
publique et des webinaires
and
pour les
webinars for
étudiants,
students,
parents et
parents,
soignants,
and
ainsi que
caregivers,
des
as
ateliers
well as
pratiques en
in-person,
personne pour les familles du
hands-on
nord de
exhibits and
l'Ontario.
workshops for family
Comme la
audiences
COVID-19 qui
across
circule
Northern
toujours
Ontario.
largement au Canada,
With
la
COVID-19 still
vaccination
circulating widely
assortie
in Canada,
d'autres mesures demeure
Vaccines
notre
Plus
mot d'ordre
remains
en
our
santé
main public
publique.
health
Les
mantra.
précautions personnelles
Personal
comme le
precautions
port du
like
masque,
masking, improving
l'amélioration de la
ventilation,
ventilation
and
et
staying home if
l'isolation
we
à
have
la maison
symptoms or
si nous
test
présentons
positive
des symptômes ou
are
obtenons un
still
résultat de
important
test
to
positif
reduce
sont
spread.
toujours importants important afin de réduire la propagation.
At the
En
same
même temps,
time,
il est
it is
très
very
important de
important to
garder
maintain
un fort
a
noyau de
strong core
protection
of
contre les
protection
maladies graves
against
en
severe
gardant une
illness by
vaccination à
getting
jour
up to
contre la
date with
COVID-19,
COVID-19
y compris
vaccines,
les doses de
including
rappel.
booster doses.
Bien qu'il existe un certain
Although there
degré
is uncertainty
d'incertitude
in the months
pour les
ahead,
mois à venir,
both
autant
for the
pour ce qui est
trajectory
de
of
l'évolution de
COVID-19
la
and for other
COVID-19 qu'en
respiratory
ce qui
viruses
concerne d'autres virus
like
respiratoires,
influenza
comme celui
that
de la
have been
grippe,
less
qui ont été
common
moins fréquents
due to
en raison
strong
des
public
rigoureuses
health
mesures de
measures.
santé publique.
The importance
L'importance
of
de la
vaccination
vaccination
is
est
clear.
évidente. Pour être
To be
préparé avec la
prepared with the
meilleure
best
protection
possible
possible
protection
contre les
against
maladies graves
serious illness
causées par
due
l'une
to
ou
one
plusieurs
or
de ces
more of
maladies,
these
il
diseases,
s'agit d'un moment
now is a
crucial
crucial
pour
time for
rattraper
catching up
tous les
with
vaccins
all recommended
recommandés qui
vaccinations
nous aident
that
à
keep us
rester en bonne
healthy
santé
from
de
childhood
l'enfance
through
à
adolescence
l'adolescence et à
and
l'âge d'adulte.
adulthood.
Merci.
Thank you.
Miigwech.
Thank you, merci. We'll turn to some questions now. Maintenant pour quelques questions.
Now a few
Premièrement,
questions. First,
Christian Noël,
Christian
Radio-Canada.
Noël, Radio-Canada. Question.
Merci beaucoup pour la
Thank you very
question.
much.
Vous dites que la récente
You
hausse
say that the
semble
recent
gérable
rise
et
seems
qu'il y a peu
manageable
d'achalandage aux soins
and
intensifs.
that intensive care units are not
Compte tenu qu'on
overly
sort
busy.
du grand
Given
week-end de
that
Pâques,
we're
par
after
exemple, qu'est-ce que
the
vous allez
Easter
surveiller
long
pour les
weekend,
prochains jours
what
pour
will you be
s'assurer
looking
que
at
c'est pas
over
le
the
cas?
next few days?
Oui, c'est quelque chose à
Answer.
suivre dans
Yes,
toutes
this is
les
something we are
provinces
monitoring in all
et
of the
territoires parce
provinces and
que oui, avec le
territories.
congé
Because
pascal,
with the Easter
on
break,
sait toujours après
we know
peut-être
that
les rassemblements de famille,
with family gatherings,
il faut attendre peut-être
we
2-3
may
semaines
need to
pour voir c'est quoi
we
les
may need to
conséquences
wait 2 or 3
avec
weeks to
les
see the
taux
consequences
d'hospitalisation aussi,
in
peut-être même dans les
hospitalization
unités de
rates
soins intensifs. Donc,
and potentially
c'est quelque chose à
ICUs.
suivre
So
étroitement
this is
et
something
je
we
suis sûr
are
que nos
monitoring
homologues des
closely,
provinces et
and our
territoires
provincial counterparts
sont
and
en mesure
territorial
de
counterparts
regarder
are also
et suivre
monitoring this,
attentivement qu'est-ce qui se passe actuellement.
looking closely at what's happening.
Et
Follow-up
si je comprends
question.
bien, il y
If
a
I've
un
understood
changement
correctly,
aujourd'hui
there's a
sur la
change
façon
today
dont les
in the
voyageurs
way
peuvent
travelers
voyager et sur
can
les
travel.
restrictions.
In
Pourquoi
regards
lever
to
ces restrictions
restrictions,
sur les voyageurs
why
à ce
lift these
moment-ci?
restrictions on travelers now?
Ça fait partie
Answer.
de notre comme dit,
It is
analyse
part
continue
of our
avec ce qui
ongoing
se passe avec
analysis
les résultats
regarding
de
what's
notre
happening
dépistage à la frontière, mais aussi
with screening at
en
the border
considérant qu'est-ce qui se passe actuellement
and
au
taking
sein
into
du
account
pays,
what's happening within the country,
avec qu'est-ce qui se passe et le
given
fait
what's
que
going on,
beaucoup,
and the
la
fact
vaste
that the
majorité des
vast
Canadiens
majority of Canadians
se font faire
are
vacciner. Je
vaccinated.
pense que c'est un bon moment
I
pour
think it's a
peut-être
good time
assouplir peut-être un peu qu'est-ce qui
to
se passe à nos
relax
frontières. Mais
measures at the
le
border,
gouvernement reste encore
but the
prudent
government is
avec
still prudent
l'assouplissement. Et
in
c'est
terms
toujours,
of
si
this,
on examine en détail,
and we are
c'est
looking at things
toujours pour
in
les
detail.
voyageurs, comme on dit,
This is for
entièrement
fully
vaccinés. Donc,
vaccinated
avec ça,
travelers.
on voit que c'est peut-être possible de
So we see it may be
être plus
possible
efficace
to
avec
be more efficient
notre comme on dit, programme de dépistage
with our screening
aléatoire
program,
obligatoire, seulement
the
pour les 4
random
aéroports
mandatory
qui reçoivent. Je
program
pense que
for the 4
plus de
airports.
90% des voyageurs qui arrivent
Over
par les vols au
90%
Canada.
of
Et aussi,
travelers coming in
même pour qu'est-ce qui se
to
passe
Canada
après. Si on
and
est
what happens
complètement
afterward.
vacciné, on
If
va
people
aussi
are fully
assouplir
vaccinated,
les mesures. C'est pas nécessaire
measures can be
de
relaxed.
rester en quarantaine pour les
People don't have
14
to
jours,
stay in quarantine
garder
for 14 days
toujours une liste de tous les contacts. Mais
and
je
have a
pense
list
que
of all contacts.
c'est toujours important aussi
But it's still
rester
important
prudent.
to be prudent.
Même si ce n'est pas peut-être exigé, c'est toujours
Even
une
if it's
bonne
not
pratique de
required, it's
continuer
still a
avec les
good
couches de
practice
protection,
to
par
have these
exemple, le
layers of
port de masque.
protection,
Si
to wear a
on est
mask
dans des espaces
in
publics,
public
peut-être
spaces,
les endroits bondés avec beaucoup de
in
monde,
places
des
that are
espaces
really
clos. Donc,
crowded
je
and
pense
closed.
qu'avec les changements, ça fait partie de notre,
So these changes are based
notre façon de continuer
on our ongoing
utiliser les données probantes et les
analysis of
sciences pour
evidence and
évaluer notre
science.
réponse.
Merci. Secondly, let's turn now to Glenn McGregor, CTV.
Oh, hi there. Just following up on Christian's question there about travelers. The United States has scrapped its mask mandate for domestic air travel. Many of the provinces are going to be doing the same thing in the coming weeks. And we'll soon be in a situation where, for most Canadians, the only place they'll be legally required to wear a mask is on an airplane. And I'm just wondering how long you think that is necessary, whether that's even still effective. And do you anticipate this spring sometime or early summer that the requirement to wear masks on either domestic or international flights will be scrapped?
Yes, it's Teresa Tam. I'll take that question. And I think this this kind of requirement requires ongoing evaluation. Right now, of course, within the Canadian context, Omicron BA2 is going strong. And you're going to be traveling with a group of people in a certain environment. I think it is prudent to continue to require wearing a mask. Again, it takes the guesswork out of the traveler. Everybody's going to be wearing a mask. It's an additional layer of protection. It can reduce transmission. Why not? I mean, it has a certain amount of inconvenience, perhaps, but it does not essentially restrict travel as such. So I think it's one of the least intrusive measures, but adds definitely another layer of protection. But I think one has always got to reevaluate policies over time, including the epidemiologic situation in Canada and overseas as well.
Also on flights, I know you've been asked many times about whether or not you think 3 vaccine doses, a booster dose, should be the definition of fully vaccinated. But at least for the purposes of air travel, given what we know about the decline in effectiveness of just the 2-dose regimen, should 3 doses not now be required in order to fly?
But first of all, what you said is really important. And any adult 18 plus should go and get a booster. And everyone should get their vaccine up to date based on your eligibility. So that's really important. And as I said, BA2 Omicron is going strong and there's activities all over the world. So get your booster. In terms of an actual requirement, on the other hand, that's a policy that needs to be examined, and it will be examined by our decision makers, the ministers in charge. So I think for sure, 3 doses in the era of Omicron is really important to have. Whether you require or not, that's a different policy decision and analysis. But any traveler, before you go traveling overseas or even across Canada, please go and get boosters. That's going to really help protect you, but also others around you.
Thank you. Ensuite, Michel Savard, La
Michel
Presse
Savard,
Canadienne.
La Presse Canadienne.
Oui,
Question.
bonjour.
Yes, hello.
Donc, l'approche prudente du Québec
So
par rapport
the
au maintien du port
Quebec's
du masque
prudent
obligatoire,
approach
est-ce que c'est la
with
meilleure
mandatory
approche ou
masking,
est-il
is that
temps
the
de
best
lâcher un peu
approach,
de lest, à votre avis?
or is it time to relax it, in your opinion?
Merci pour la question.
Answer.
C'est
Thank you for
Dr.
the
New. Je
question.
pense
Dr.
que
New here.
on parle toujours des mandats ou
We've talked
des
about
exigences pour
mandates and
le port
requirements
de masque. Et
for mask
d'après moi
wearing.
aussi,
But in
Dr.
my
Tam, moi, on
opinion,
a
Dr. Tam
répété
and I
souvent que
have often said,
si on regarde les données
if we look
probantes,
at the
les preuves scientifiques, c'est
the
toujours
scientific proof,
une bonne couche de
it's always a
protection
good layer of
personnelle.
protection
C'est quelque chose qu'on peut
at a
contrôler
personal level. It's something
comme
we can
lui-même. Et c'est
control
toujours,
ourselves.
d'après moi, une bonne
And in my
pratique
opinion, it's a
personnelle.
good
Si on
personal
est
practice
peut-être dans un contexte où
in a
on est
context
dans un espace clos,
where
peut-être
it's a
avec un contact
closed,
étroit avec
crowded
plusieurs personnes,
space
des étrangers qui ne
with
font pas partie de
people who aren't part of
c'est le ménage et
our
aussi
household
pour un bon bout de temps. Pour moi, c'est pas une question est-ce que
for an
c'est
extended period of
obligatoire ou
time. It's
non. Je
not a
pense que c'est
question of whether
j'espère
it's
que
mandatory or
ça
not.
va continuer d'être
I
une
think it will
bonne
continue
pratique
to be
personnelle que
a
tout le monde
good
veut
personal
continuer à
practice
utiliser
that
parce que
everyone can
ça se
continue to
protège, mais
use
aussi c'est
because
aussi
it's to
une
protect
mesure
yourself and
pour
it's a
protéger
level of
les autres.
protection for others as well.
D'accord, merci. Et puis, Dr.
Follow-up
Tam, j'aimerais
question.
vous
Dr.
entendre
Tam,
répondre
I'd
à la
like to
même
hear
question que
an
mon collègue
answer
anglophone vous a
to the
posée
same question that my
sur s'il est
Anglophone
toujours nécessaire
colleague
de
asked you
porter un
on whether
masque
it's
dans
still
un avion,
necessary
quand
to
est-ce qu'on
wear
pourrait
a
lever
mask
ça,
on a
vous sembliez
plane. When will
dire,
that be
pourquoi pas le garder?
lifted? You seem to say, why not keep it?
En ce moment, étant
Answer.
donné que
At this
le
time,
taux d'activité
given that
de
the
COVID-19
level of activity
haut,
of COVID-19 is
c'est
high,
toujours prudent de
it's
porter un
still
masque.
prudent to wear a mask.
Donc maintenant, le ministre
So now,
de Transport
the Minister of
a déjà
Transport
dit On va continuer de cette
We will continue
politique
this policy
en ce qui concerne le porteur de masque
regarding
dans
wearing a mask
un transport en commun.
on
C'est
public transit.
une chose qu'on peut évaluer, mais
It's
porter un
something
masque,
we
c'est
can
pas une
assess,
grande
but wearing a mask
imposition
is not
pour
a
le
major
public.
imposition for the
C'est une
public.
couche de
It's
protection
a layer of
importante
protection
pour
that's important
protéger les autres
to
aussi.
protect others as well.
C'est Dr. New. Peut-être justement pour
Dr.
souligner
New
les
here.
points que Dr. Tam a
highlight the
déjà
points
fait. Que,
from Dr.
oui,
Tam.
ici, on regarde les environnements,
If
les
we look
contextes
at the
différents. C'est
different contexts, different
évident pour moi
environments,
que, OK,
it's clear to me
si peut-être on est dans un centre d'achat,
look, if
peut-être
you're in a
c'est bien
shopping center
ventilé,
and it's well
on a
ventilated,
peut-être une distance entre
distance
vous et les autres
between you and other
clients.
people,
C'est différent si on
different
compare ça
compared
à l'environnement dans
to the
un
environment
avion
of a
avec
plane
beaucoup de personnes
with many
contact
people
étroit pour une bonne
who are in
durée
close
de temps et
contact for an extended period of
aussi
time,
avec des personnes qui ne font pas partie de
and
votre
with
ménage.
people who are
Donc,
not
je
part
pense
of
que
your
c'est une bonne
household.
pratique qu'il faut
So I think it's a
continuer
good practice. We should
à utiliser
continue
comme une couche de
to use
protection
it as
personnelle et
a
aussi pour
personal
protéger
layer of
les autres.
protection and to protect others.
Merci. Next, turn to Dylan Robertson, the Winnipeg Free Press. Dylan.
Hi there, I'm unmuted now. Thanks for taking our questions. Dr. Tam, I just want to ask you about the three prairie provinces lagging behind everyone else for booster shot uptake and second dose uptake. The demand seems to have dried up. There are super sites being closed. You can still get shots in a doctor's office, but it seems few people are asking for that. So I'm wondering if you have any concerns about one region being behind everyone else, especially when they're overrepresented in hospitalizations right now, and what we should do about that.
I think a very multifaceted approach is needed to increase the booster rates, particularly for adults over 50, but depending on your risk factors. But anyone over the age of 18 years of age and older, NACI now recommends that you get a booster shot with a general interval of six months. I think right now, with the Omicron BA2 wave still very much active, this is a good time for people to actually get vaccinated. So, but it does take many different approaches, and some of which we've actually talked about in our opening remarks is getting community organizations who can have a reach that perhaps governments by themselves cannot do into different community, figuring out why is it that they're not getting vaccinated. Is it because they don't understand the importance of the third dose? Is it because they think if they just got vaccinated, how long they should wait to get the boosters? Those questions may need to be answered in different languages. And so I think those community programs will be really vital. Certainly having access points that are convenient, going to where the people are to help them get access in the most readily available approach would still be important. But I think, this all chief medical officers right now are trying to re-communicate with everybody about the concept of up-to-date vaccination. So I think we have to explain to everyone that because of Omicron, which is that immune evasive variant, that third dose is really important, and it can give you a boost in reduction against infection, at least for a period of time, and transmission to others. But it can also strengthen the immunity against severe outcomes. And most of the vaccine effectiveness studies shows that you get over 90% vaccine effectiveness against Omicron for severe outcomes. So what you were saying, like ICUs and hospitalization rates being still high in certain provinces, don't seem to be coming down very fast. Please do go and get that booster because it is very, very effective. I think, are we concerned? Yeah, we would love to get people mobilized once again to, like they did the first round and the second round, to get that booster dose. We probably haven't done enough good communication from all angles, public health and otherwise. And so we're trying to do that once again and give it another shot, as it were. But do, obviously contact your local jurisdictions as to how you get that shot in. But we do need to, I think, get another boost of energy for Canadians to get that booster. Of course, if you're in a really high risk groups, including the most senior of our population, a fourth dose or a second booster is also available. And we are seeing the fourth dose rates going up faster, perhaps, than our third dose. And so we would like to encourage everybody to get that very important third dose.
Thank you. And on a totally different note, I wanted to ask about overdoses. Manitoba recently reported data that drug-related deaths have more than doubled in the past 4 years. It's not as bad as BC, but this trend seems to be heading east across the prairies, as it has been for a number of years. There's been talk about decriminalization of drugs locally, and I'm wondering how that fits in as a tool. If decriminalization is helpful, if it's a silver bullet, or if it's a counterproductive idea. So,
Dylan, you hit on a really, really important public health crisis that I hope everybody is aware of. During the pandemic itself, the substance use, opioid or multi-substance use related crisis has escalated due to, I think, multiple factors. Connection is very important for individuals who use drugs, and some of that connection was lost perhaps during the pandemic, and access to harm reduction services. We need a holistic approach to reducing substance use related harms and the deadly effects of some of the drugs that are currently circulating. And that is a whole range of prevention, but harm reduction, access to safer supplies. That's something that Health Canada and the federal government's been trying to do, is to set up a number of projects and programs across the country to see the effectiveness of the provision of safer supplies because of just how toxic the drug supply is right now. Decriminalization serves to reduce stigma and really help focus the fact that substance use is a public health issue and not one of criminalization issue. So I think that's the most important aspect of decriminalization, but it cannot be, a single measure is not a silver bullet. You have to have all the other full multi-layered approach, including prevention, harm reduction, safer supply, treatments, recovery, and of course, social and economic support measures to address the determinants of health. But I think different approaches, best leveraging the, knowledge base of the community of persons who use drugs and their families. That's really important in finding solutions. But I know that a lot of cities as well as provinces are currently examining the policy of decriminalization and applying to Health Canada on that matter.
Thank you, merci. Next up, nous avons Mylène Crête, La Presse.
Mylène Crête, La Presse.
Bonjour.
Question.
J'aimerais savoir
Hello.
concernant
I'd like to
l'assouplissement
know
des
regarding
restrictions pour les
the
voyageurs, il y a
relaxation of
celle
restrictions for
de
travelers.
l'obligation de porter un
There is
masque
the
dans les
obligation
endroits
to wear a
publics est
mask in
levée là,
public
dans les
spaces.
14
That's
jours
been
suivant
lifted in
l'arrivée au
for the
Canada.
14 days following
Je me
the return to
demandais, c'est
Canada.
pas défini
I was wondering,
quels sont
it's not
ces endroits
defined.
publics.
What are those
Est-ce que
public
vous
spaces?
pouvez être plus précis?
Could you elaborate on that, please?
OK. Merci pour la question.
Answer.
C'est
Thank you for
Dr.
the
New. Je
question.
pense
Dr.
que,
New here.
pour simplifier, on dit
To
que
simplify,
les obligations,
we're saying
l'exigence
that the
fédérale, c'est
requirements, the
vraiment
obligations at the federal level,
on est dans un transport comme un avion sous le mandat du gouvernement fédéral et aussi dans les aéroports. Mais quand on parle de l'aéroport, je pense que c'est facile de penser, OK, on est maintenant dans une province ou territoire et il faut suivre les exigences ou
and you
les
need to follow
obligations
the
des
requirements
autorités à l'échelle locale.
of the local authorities.
Donc, si j'ai bien
Follow-up
compris,
question. If I've
l'obligation de
understood
porter le
correctly,
masque
the
demeure
obligation to
dans
wear a
les avions,
mask
dans
is
les
still in place
aéroports,
on planes
mais
and
elle est
in
levée dans
airports,
les
but it is
provinces
lifted
où
in the
cette
provinces
obligation-là
where
n'est
that
déjà
requirement
plus en vigueur.
has
J'ai
already
bien
been
compris?
lifted. Have I understood correctly?
Oui, effectivement,
Yes.
c'est toujours une bonne idée. On
It's always a
recommande
good
toujours,
idea.
c'est une bonne
We
idée de
recommend
porter un masque
wearing a mask
peut-être que si on est dans certains contextes,
in certain
toujours, je
contexts,
parle des becs, il y a des lieux bondés
in crowded
avec
places,
peut-être le contact étroit des
with
espaces
close
clos, mais
contacts and
je pense
close
qu'on respecte
spaces.
aussi qu'est-ce qui se passe actuellement dans les provinces et
But I'm
territoires.
thinking
Et
of what's
pour le
happening in the
gouvernement
provinces
fédéral,
and territories. And for the
on est
federal
responsable
government,
pour
we are
les
responsible
transports aériens et aussi
for air
les aéroports,
transport
mais
at airports.
si quelqu'un sort d'un
But if
aéroport, je
someone
pense
leaves
que
an airport,
c'est vraiment sous la, comme on dit, les juridictions,
really under
l'administration des provinces et
local
territoires.
jurisdiction of provinces and territories.
D'accord, merci.
Okay, thank you.
Merci. Maintenant, Olivier
Thank you. Now-
Fellon-Boissé, TVA.
Olivier from TVA.
Oui, bonjour.
Question. Yes,
Merci de
hello.
prendre nos questions.
Thank you for accepting my question.
J'aimerais savoir qu'est-ce que vous
I'd like to
pensez, qu'est-ce que
know
vous savez plutôt sur le variant
What you know about
BA2.12 qu'on voit
the
vraiment prendre la
variant
place en ce moment aux
we're
États-Unis.
seeing in the
Est-ce
United
qu'il vous
States
inquiète
now.
et est-ce
Is
qu'il
it
est
of
détecté
concern to you?
présentement au
Has it
Canada?
been detected in Canada?
Oui,
Answer.
merci pour la question.
Yes,
C'est
thank you for
Dr.
the
News.
question. Dr. New here.
Pour l'instant, c'est toujours, comme on dit, une question de continuer
It's
avec
still a matter
notre
of
surveillance,
continuing with
avec
our
notre
monitoring,
système laboratoire, aussi
with
avec
our
notre
laboratory system.
laboratoire Winnipeg. On est
Winnipeg.
toujours en train de regarder
We're always looking
les séquences des variants
at variant
qui font
sequencing,
l'apparition ici au Canada, mais
variants
aussi
that
à
appear
travers
here
le
in
monde. Et,
Canada and throughout the
on a
world.
aussi, on continue avec même un programme de
We're
dépistage
continuing with a
aléatoire obligatoire
random mandatory
à
screening
notre
program
frontière pour
at the border
être capable de détecter.
to be
Je
able
parle
to
des
detect
données
things.
exactes, d'après moi, peut-être Dr. Tam
I
pour
don't have the
exactement
specific
ce
data in
variant,
front of
mais
me.
ce
Perhaps
n'est pas
Dr. Tam can
inattendu parce
elaborate.
qu'on
But
sait
it's
que
not
le virus
unexpected
continue à
because we know that the
évoluer. Il y a
virus
toujours
continues
peut-être même des
to evolve.
recombinaisons, des variants
There are
peut-être
different
pour
combinations of
avoir un
variants.
autre variant, mais à
There could be a
date,
new variant.
pour l'instant, c'est vraiment
But
le
for now,
BA2 qui est
it's really
le variant. Je pense que
BA2
c'est
that
plus
is
de
the variant here, responsible for
70%
over
des
70%
séquences sont le BA2, mais
of
pour
cases.
ce que le variant, ce que vous
The variant
mentionnez
you've
maintenant,
mentioned,
je n'ai pas les données
I
exactes, mais
don't have
peut-être Dr.
exact
Tam est en
data,
train de
but
peut-être
perhaps Dr. Tam
regarder nos notes pour
is looking at our
peut-être donner une
notes
autre réponse.
to provide another answer.
Oui, on peut faire suivi
Answer from Dr. Tam.
après, mais
We can do a follow-up
selon
later.
mon
But
connaissance,
based on my
niveau de
knowledge,
connaissance, il y avait plus de 2000
there were over
détections de
2,000 detections of
BA2,12,
BA2.12,
mais il y a un autre variant,
but there's another variant,
BA2.12.1.
12.1.
C'est le deux variants
So
de
two
BA2
variants of
qui est en
BA2
train de épanouir aux
that are
États-Unis,
spreading
dans les
in the
États de
United
New York.
States, in
On
New
a
York State.
détecté moins de 10 cas, à peu près 6 cas de BA2.12.1.
For
12.1. Mais
BA2.12.1,
nous sommes en train
we've
de
seen cases
faire la surveillance
that we're
étroitement
monitoring it
concernant
closely
les sous-variants de
regarding the
BA2.
subvariants of BA2.
Merci. En effet, c'était bel et bien le
Thank you. So
BA2.12.1 que je parlais. Donc, j'en
2.12.1,
comprends
that's the one I
qu'on en a
wanted to
détecté
mention.
moins
So I
de
see we've
6
detected
pour
fewer than
l'instant.
6
Merci pour
cases
ça.
for now.
Et
Thank you for
mon autre
that.
question concerne
And my other
le
question
Moderna qui aimerait
has to
faire
do with
un
Moderna,
vaccin
which
s'attaquant
would like to
justement
have a
aux
vaccine
variants, aux sous-variants pour
for
l'automne.
subvariants for the
Et quelles sont
fall.
vos attentes par
What
rapport
are
à
your
ça? Et est-ce
expectations
que
in
vous
regards
croyez
to
que les
that?
Canadiens devraient
Do you think
le
Canadians
considérer s'il
should
devenait
consider that if
disponible
it were to
plus
become
tard cette année?
available later this year?
Merci pour la question. C'est
Answer.
Dr. News.
Thank you for the
Je peux
question,
commencer.
Dr. New here.
C'est
I can
toujours comme
begin.
dit, encourageant que
It's always encouraging
les compagnies comme
when
Moderna
companies like
continuent
Moderna
avec
continue
leur comme les recherches
their
aussi
research
avec avec peut-être des formulations peut-être pour mettre à jour contre les variants qui continuent à évoluer. Ce qu'on voit avec les résultats des études à date, c'est que c'est encourageant dans un contexte de laboratoire. On a des bons résultats à date, mais il faut continuer avec les essais cliniques, avoir plus de peut-être des personnes qui reçoivent peut-être dans le contexte d'un essai clinique et après on attend peut-être une soumission ici peut-être au Canada mais aussi aux États-Unis et des autres pays, mais pour l'instant on n'a pas quelque chose clair pour des dates, mais on attend qu'est-ce que la compagnie moderne, mais peut-être même aussi les autres compagnies continuent avec leur recherche. Mais je pense que c'est encourageant, d'après moi, parce que les compagnies continuent de regarder qu'est-ce qui se passe actuellement avec la COVID-19 et les variants préoccupants. Et c'est sûr, peut-être en automne, peut-être on peut avoir peut-être une vaccin peut-être à date contre les variants.
Merci. I believe we have one more question here. Laura Osman, Canadian Press.
Another 3 hours. Hi, doctors. I want to start by asking you about hospitalizations. Dr. Tam, you mentioned that so far hospitalizations are remaining manageable. I'm wondering if you're noting a situation that we saw during Omicron where hospitals were still feeling overwhelmed, not because of the number of hospitalizations, but because so many health workers had to be off sick.
There was a bit of noise online, but yes, I think according to my colleagues in the provinces and territories, one of the issues that not as bad as in the first Omicron wave, but there's still a significant impact of the current resurgence on healthcare worker absenteeism. So they may not be very sick, but if you get test positive, you're going to have to stay away from work for a period of time. And because of activities in the community, health workers also have families who may be positive. So they could be contacts in the household and other settings. So yes, that is one of the factors that can impact the health system capacity at the moment. And which is why I think everyone needs to continue to do all that we can to reduce transmission in order to protect the health system. At the moment, I think in some jurisdictions, they're managing, but they're really stressed. The system is stressed. Our modeling is projecting still an increase in hospitalization, but probably not as bad as the initial Omicron wave. As we said it throughout our remarks, we have to see what happened over the long weekend. I hope people actually went and got boosted and didn't spend a lot of time in spreading Omicron to others. So we will see what happens over the long weekend just to have a better idea of what the impact on the health system would be in the next couple of weeks.
Perfect. Thank you. I also wanted to turn now to travel. With these small changes, the government seems to be signaling that they want to take a more sustainable approach to restrictions. Dr. New, I heard you say that if people are fully vaccinated, then we can start to ease some of these restrictions. But many people are asking, of course, for the vaccine mandates to be dropped or wondering when that will happen. Is it your advice still that that is sort of the key feature of the travel restrictions that need to remain in place?
It's Dr. New, so maybe I can start and Dr. Tam can certainly add to it. But you're right. I think at the end of the day, I think everyone is in agreement that vaccines are still our major tool, a major layer of protection. And so, both, inside Canada for all Canadians, but also for travel purposes, I think it's important to stress the point that, the higher our vaccine coverage is, the better we all are overall in terms of protecting against the serious consequences of COVID-19. And so, as we move forward, certainly we'll continue to look at the evidence, the data, and adjust as necessary. And the one thing I would say is that, even with the changes that have been made with respect to our border measures, and many of them, obviously, you can imagine there's operational considerations as to why it's been put in place now, and as opposed to maybe some other time. But it's important to maintain that infrastructure. So we have things like testing and so on. We want to maintain that. So, should there, unfortunately, maybe COVID-19 takes a turn for the worst and we need to readjust and go back to a different regime, or maybe similar to what we might have had before, we're ready to do that. So I think that's the key feature of what we're doing at the border, trying to remain, I think, flexible and nimble as well, should there need to be adjustments made. But yes, I think at the end of the day, not saying anything about it from a policy perspective, but yes, the higher a vaccination rate is, the higher, the uptake is of vaccines, the better overall. So that's all I will say. And it doesn't really matter if it's relating to travel or just within Canada for Canadians in general. Thanks.
Those are all the questions we have for today. So I'd just like to thank everyone. Merci, Miigwech. And if you have any final thoughts, please go ahead.
Go get boosted. Thank you. Travel safe. Thanks, everyone.
Recording stopped.